Welcome to rePROs Fight Back, a podcast on all things repro. I'm your host, Jenny Wetter, and each episode I will be taking you to the front lines of the escalating fight over our sexual and reproductive health and rights at home and abroad. Each episode, I will be speaking with leaders who are fighting to protect our reproductive health and rights, to ensure that no one's reproductive health depends on where they live. It's time for rePROs to fight back. Hi, everybody, and welcome to this week's episode of rePROs Fight Back. I'm really excited about today's conversation. We have in studio a wonderful advocate from Nigeria to talk to us about reproductive health and rights in Nigeria. So, without further ado, joining me today, we have Hauwa Shekarau with Ipas Nigeria, and she is the country director with Ipas Nigeria. Hauwa, thank you so much for being here today.
Thank you. Thanks so much for having me.
So first, why don't you tell us a little bit about why you're in D.C. right now?
I got invited to participate in an event organized by Population Connection with respect to the global gag rule. And this is based on the fact that we had done some work on the impact of global gag rule in Nigeria, and Population Connection supported us in doing that project and wanted me to come share, results or lessons learned from that project.
Oh, great. So We'll get to that a little later, but it was good to hear why you're here.
Yeah. And of course, I have other things also lined up, to do while in D.C.
Good. Well, I hope you get a chance to enjoy the city a little bit as well.
Yeah.
It's a nice time of year.
I love the weather. It's not as harsh as I thought it would be.
Yes, it's a nice time right now. And so why don't you tell me a little bit about IPAS and the work IPAS Nigeria is doing?
Okay, IPAS in Nigeria is globally actually is working towards reducing maternal deaths from unsafe abortion. In fact, our goal is to have zero, unsafe abortions, in the world. At the moment, there are about 22 million abortions happening globally, and we're working to ensure that we completely reduce that. And so in Nigeria,
22 million unsafe.
Unsafe abortions, And so in Nigeria, we work within the limits of the law to ensure that women do not die from unsafe abortion, reduce the complications of unsafe abortion, and also enable women to have access to quality reproductive health choices. The law in Nigeria is very restrictive. It only allows abortion where the life of the woman is in danger. And so even though the law is supposed to, reduce incidences of abortion, unfortunately, that is not the case.
Right.
Studies that have been conducted in Nigeria have shown that the law is not really reducing the incidence. Rather, abortions are increasing on a daily basis. In 2012, a study conducted by Guttmacher Institute with the University of Ibadan showed that there were 1.25 million abortions taking place yearly. And then recently, PMA 2020 conducted a study, and they also found that it has actually gone up to about 1.85 million. So the reality is that the law is not stopping women from having abortions. Rather, what it has done is push clandestine abortions, and that is the problem because, quacks are having a field day, and this is because when a woman gets pregnant and she doesn't want that pregnancy, probably based on the circumstances of, that pregnancy, most women would want to keep that pregnancy. A few with counseling might decide, okay, I'll keep it. But most would insist that they terminate that pregnancy. And since the law is restrictive, they cannot go to any healthcare facility and get the service. And so they resort to quacks and sometimes unwholesome, practices in order to terminate that pregnancy. In fact, in Nigeria, women and girls sometimes use bicycle spokes to pierce through their, vagina right into their reproductive tract,
right,
in order to, terminate that pregnancy. And most times when that happens, they begin to bleed, and if not attended to, they become infected, and some of them don't live to tell their stories. Some of them die as a result. And so that has continually increased the number of maternal deaths from unsafe abortion. And I think it's important to also note that Nigeria has one of the highest maternal mortality rates in the world.
Right.
And unsafe abortion is a high contributor to that maternal mortality. So these are some of the issues that Ipas in Nigeria has been working on, ensuring that women do not die from these complications. In reality, the work that we do is what I call acting after the facts.
Right.
It's like a tap is running and we are mopping the water running from that tap. And as long as that tap remains running, we will continue to mop. We will not finish mopping, and so that is the situation of the kind of work that we're doing post-abortion care, because the law does not allow for, women
abortion
to have
care.
Access to abortion. Yeah.
Yeah, I feel like that is something you see everywhere. Is people seem to think that they can outlaw abortion and it will stop abortion, but all it does is make it unsafe and put women's lives in danger.
Absolutely. The law, even not just in Nigeria, in other countries where you have restrictive abortion laws, evidence has shown that it doesn't stop abortions. Rather, the abortions continue to happen on a daily basis, and women resort to very unwholesome practices in order to terminate those pregnancies. And I think that is really, really unfortunate. What it means is our government is not responding to the yearnings of her female citizens. And the reality also is that there's also gender-based violence on the increase. In Nigeria, almost on a daily basis, you read in the pages of papers on social media of sexual violence meted out against girls and women, and definitely when such happens, there's the possibility of getting pregnant happens. And once a woman is pregnant, if she doesn't want that pregnancy, she will go to any length to terminate that pregnancy. In fact, at Ipas in Nigeria, we conducted a study some years ago, about over a decade ago, and we titled it, "She Will Have Her Way." And we went around interviewing women, and the results came out that once a woman has an unwanted pregnancy, she will do anything. She doesn't even think about the law. She doesn't even remember there's a law that stops me from doing this. She's
thinking about what's best for her and her
family.
Absolutely,
yeah. So that is the very unfortunate situation we find ourselves in Nigeria, and we are working to ensure that we avert, maternal deaths from unsafe abortion. And one of the very important, aspect of our work also is to also provide women with contraceptive care, because yes, women also need to know how to control their fertility through the use of contraceptives, commodities, and all that. However, if you look at the statistics in Nigeria, our contraceptive prevalence rate is very low.
Right.
We have today in the country, the average is about 15%, and in different parts of the country, the rate varies. In the northern part of Nigeria is as low as 6%. for women of reproductive bearing age. That is extremely very low. And no wonder we have such a burgeoning, population.
Right.
Nigeria,
absolutely.
our population at the moment is estimated to be close to about 200 million people. And poverty is very, very prevalent. Close to 70% of the population live below $1 per day. So it's, there are just so many things that are just not working well.
So clearly interrelated. If you don't have access to contraception, or you're not using contraception, you can't plan how many kids you're going to have. You
definitely.
can't. It's hard to work or go to school.
Yes, absolutely.
And those are things that affect poverty. So
Yeah.
it's all very connected.
Yeah. And, there's this saying that poverty wears the face of a woman, and that is the reality in Nigeria. The very poor are women. Some of them don't even have opportunity to go to school.
Right.
So it's really a very difficult situation, and international organizations and other local organizations, non-governmental organizations, are working in to help ameliorate some of the difficulties that we face in the country.
So what would you say are some of the main reasons for the low contraceptive prevalence rate? Is it is a lack of access? Is it there's myths around it? You hear that in some places, or male disapproval, or
yeah, I think there are various reasons. You have just mentioned most of them. One of it is lack of access, because there is a high unmet need of the contraceptives, and then there's also a lot of myths surrounding contraception, contraceptives. One of it is people believe that it is abortion.
Right. You hear that in
Especially
the States
people
as well.
who are faith-based groups.
Yep.
Would say contraceptives is abortion, and they are against abortion, so they don't use it. And then you also have the misconception about the contraceptives leading to permanent infertility and all that. So there are lots, and there's also male disapproval. So that is also another factor. And so a lot of misconceptions, cultural, norms that are against the use of contraceptives.
So we talked about a number of reproductive health issues facing Nigeria. Did we miss any that are facing Nigerian women?
Gender-based violence.
Yes.
Very, very important. And this is happening on a daily basis across the length and breadth of the country.
Well, when you look at it worldwide, it's 1 in 3 women are going to face that in their lifetime. And that's a worldwide issue that definitely needs to be addressed.
And the issue is that most perpetrators of gender-based violence are not really strangers. They're usually intimate partners.
Yeah.
Some of them are members of the family. Some of them are even people that you would expect should be committed to taking good care of these women and girls.
Yeah.
And that is where the problem, is. And the reality also is that there isn't sufficient political will to deal with this issue. In some cases, in Nigeria, for instance, when you go to the police, even though I would admit that the police has improved and they are doing better than they used to be, but we still have some places where women who, first of all, after overcoming the culture of silence, that barrier for fear of stigma and all that, and they come out to report such incidents, they either are not believed, or the law enforcement agents do not take it serious.
Yeah.
And then there's also this cultural norm especially where the perpetrator of the violence is an intimate partner, either a husband, a partner, or so. When the woman keeps complaining, she's told within the family to say, you know what, you need to endure it. You need to endure it either for the sake of the children or for the fact that you don't want the world to see that your marriage failed or things like that.
Yeah.
So most times women continue to suffer in silence. They continue to endure, that violence. Sometimes before you know it, it's their dead bodies that show how bad that has been.
Absolutely. I feel like that's kind of a universal story, something you still hear in the U.S. It's so hard to leave, and if you do, it's the most dangerous time, and you end up with, the woman being killed, or, people saying, stay, or not believing how bad it is.
Absolutely.
It's just so tragic, and again, so many women are facing it, and it's not taken as seriously as it needs to.
Yeah, and there's something that is now kind of coming out. Some of these women who continue to endure the violence and remain bottled up, it gets to a point they then revolt, and this has led to some husbands being killed because of either bottled up, tension and emotions from the woman. And at the end of the day, the people don't understand, why did she kill her husband?
Right.
She has been complaining of abuse, sexual violence, and domestic violence. And everybody said, just endure it, just keep quiet, and then it gets to a point she cannot take it anymore. And then she fights back. And usually fighting back could be fatal.
So one thing we haven't talked about, are there any particular challenges around young people and young people accessing reproductive health care?
Oh, yes, absolutely. That is also one of the major reproductive health problems that we have. Because of cultural norms and values, sexuality education, for instance, in school is frowned at. Parents and faith-based groups have risen up to condemn sexuality education in the schools. According to them, their children are being taught how to have sex and all that. But the reality is that the world is evolving. The world is not static. The world is dynamic. Things are changing, particularly in this, internet age that we're in. So if you think, your child should not be taught anything in school, the phone.
Right, they're going to learn it somewhere.
Has loads of information that children, young people have access to. And you cannot control where or how they get this, how truthful this information is. So in actual fact, by fighting comprehensive sexuality education, we're actually shooting ourselves in the foot. Because at least when you allow comprehensive sexuality education, then you know that your wards or your children are being taught age-appropriate comprehensive sexuality education. And that is very, very important. And so, because the government is not too comfortable with that, that has left the young people almost on their own. And the social media age has therefore enabled them to go on a foray of their own without any guidance, without any, somebody to really guide and let them know what is right and what is wrong. So this has really affected the young people. And many of them are victims of sexual violence. Many of them are victims of unwanted pregnancies and so on and so forth. And because also of the social norm, whenever they go to the hospital, it's so difficult for them to have access to contraceptive services. Because the attitude of workers is not also welcoming to the young adolescents. For instance, they might go there and they say, "What are you doing here? Are you married? Why
Right.
do you need family planning?" And so it's, in fact, the one of the studies we conducted at Ipas about the reproductive health seeking behavior of young people, they don't go to hospitals. Most of the time, they patronize some of these patent medicine vendors for some of their reproductive health needs. And these patent medicine vendors are mostly untrained people who stock drugs and chemicals and all that. Instead of helping the situation, some of them are actually doing more harm.
Right.
And so that is a lot of the adolescents. And so one of the things that we do at IPAS is making sure we engender youth programming in the work that we do. We work through youth groups such as the Nigerian Medical Students Association. We also work with youth-led organizations, both at the grassroots level and also within the community in urban areas as well, in order to get information to the young people through these groups. But definitely, it's so very important that the young people are carried along. And we also carry out advocacy also to the government, making them understand the importance of not leaving the young people behind, because they are the future.
Absolutely.
And if you do not carry them along and, give them the necessary information, the truth is we are already harming their future.
And it's so important, like changing policy, but also, you touched on this a little bit, making sure to be working with providers so that young people aren't getting stigmatized care. If they go seek care, that they are able to access the services they need and not shamed for them.
Yeah, that's right. Very, very important that people are given non-directional counseling. Counseling is very important. One of the things we have discovered is that because of the huge population and then the few number of qualified trained personnel, they hardly give enough time for counseling. And counseling is as important as even the care that you provide. And it's really a big challenge. We have a serious case of brain drain. A lot of our medical personnel, as soon as they qualify, they're already wanting to leave the shores of the country. And so what we have left are very few professionals who are providing service. And also, one of the major reasons for that is also poor remuneration. They're not well remunerated.
Right.
And, of course, for the professional who has been trained and all that is seeking for better remuneration, and so they leave the shores of the country. But it's indeed a very big. You won't believe that in Nigeria, there are some healthcare facilities in the grassroots communities in very, very remote areas that do not have a single trained medical doctor. So most of the time, it is mid-level providers that provide services in such communities. And that is why the government has taken it very serious to engender the tax shifting policy that enables middle-level and low-level career healthcare workers to be able to handle some, services which in the past was reserved for, senior
Doctor,
cadre. Yeah.
So one thing we haven't touched on yet also is the role that conflict is playing in reproductive health in Nigeria.
Yeah. Nigeria has been in the news for the last 5 years.
Yeah.
With the security challenge that has been occasioned by the Boko Haram insurgency. Things have, things have improved in the sense that we used to have that fear in even urban cities like the Federal Capital Territory and other northern cities. But at the moment, things are a bit limited to the northeastern part of Nigeria, and particularly 2 states, Borno, Yobe, and a part of Adamawa State. But then there are also other issues aside from the Boko Haram insurgency. You have the headers terror, I would say, against the farmers in the north central parts of Nigeria and other parts of Nigeria. So truly, the conflict situation has exacerbated the situation of things in the country. And we have also, that is another reason that has led to increased gender-based violence. Because most of the time, the women and girls are victims.
Right.
There's a lot of kidnappings also going on, kidnapping for ransom. In the case of, women and girls being kidnapped, they are subjected to rape, gang raping and all that. So that has also, created a great challenge in the area of reproductive health.
So we've talked a little bit as we've gone along as what the government of Nigeria is doing to address reproductive health. Do we want to touch on that a little bit?
Yeah, I think the government has also doing their bits, but I think there's much more to be done. There's room for improvement. First and foremost, the funding made available for the health sector is not as it should be, as recommended by the World Health Organization. So I would expect that the government should live up to their commitment to meet that minimum budgetary requirement that has been placed by the World Health Organization for all health ministries. And I think once that is done, then we're going to see a lot, because there's nobody is as wealthy as the government. The government has the resources. However, we have international organizations that are also stepping in through foreign aid to support some of these health challenges that we have in Nigeria. Of course, there's a lot to be done, and the government really needs to step up. They need to prioritize the area of health with particular focus on women's reproductive health. And I think for me, one other problem that I see is the lack of gender-based budgeting. And I think the government needs to do a lot more of that, because to budget blindly without having a recourse to the fact that, we have so number of women, so number of reproductive age-bearing women, and then we have so number of menopausal women. Working with statistics and then budgeting based on that would be more productive rather than just blind budgeting. Because at the end of the day, you miss the point. When women of reproductive bearing age go to the hospitals and services that they require are not there simply because they were not budgeted for, then it leaves much to be desired.
And I'm sure Ipas Nigeria is working to fix that.
Well, like I said, our major focus is on reducing maternal deaths from unsafe abortion, as well as providing women with contraceptive care. That is the niche that we have found for ourselves. However, we're working closely through partnerships and collaborations with other organizations that are focused on other areas. We belong to the National Reproductive Health Technical Working Group that was set up by the Federal Ministry of Health. And together, we are looking at the issues of women's health at a holistic level. So yeah, in one way or the other, we are contributing towards finding the solution.
Great. Now we're going to go kind of back to the beginning, which is the reason for your trip here.
Yeah.
So how is U.S. policy affecting reproductive health providers in Nigeria?
Dayo, I'm sure we're talking about the global gag
Yes.
rule. Yeah, the global gag rule is harming the Nigerian women. I want to limit myself to Nigeria, but I
Yes.
can assure you that
It's
when
not
I
alone.
say Nigeria, it affects also Africa, because they said out of 4 Africans you see, 1 is a Nigerian. You know, we have the most populous African nation in Nigeria, and so the role of the U.S. government is large, because so many reproductive health organizations receive U.S. funding and must abide by the rules of the U.S. The U.S. government is like the big brother
Yeah,
that
absolutely.
we see. You know, and so the funding that comes through the U.S. government is huge. And so if the U.S. government provides one of the largest fundings that we have, with this restriction, with the Mexico City restriction on use of, U.S. funding to provide abortion-related care, counseling services and all, it then tells you that it is really, really affecting women's ability to access quality abortion care in Nigeria. And the reality of the global gag rule that was introduced by the Trump administration is even more far-reaching than the previous. Because what the Trump global gag rule has done is that, aside from not using U.S. funding to provide abortion care and services, it also stops organizations that receive such funding from using their own, resources,
Right.
to provide, abortion care and services. This is very, very far-reaching, and apart from that, it has also implication on other health programming, such as malaria, tuberculosis, and what have you. And so, the space for civil society is shrinking because of the global growth. Fewer organizations are participating in advocacy space. At Ipas, we are we're a small organization. In Nigeria, for instance, I have a staff strength about 21.
Mm-hmm.
And then we're talking about a country of almost 200 million people. So we've been able to, in the past, work and have a farther reach through collaborating with other organizations and NGOs that are working in different parts of the country. Now, by reason of this global gag rule, some of these organizations that we used to work with can no longer work with us. And what it means is that it is reducing, our reach.
Right.
And some clinics have closed as organizations have lost U.S. funding. A very good example is MSI. MSI has presence in almost every part of the country. Now, because of the global gag rule, they've had to lose funding. And definitely this has affected some of their service provision in the parts of the country. Of course, there are so many other organizations that I do not need to mention here.
Right.
But definitely it is affecting Nigeria. There's also what we have noticed with the grant we had from Population Connection to do this project on the global gag rule, we realized that some of the local NGOs that are getting either sub-grants or small grants from some of the bigger NGOs were really not very aware about this global gag rule. There's a lot of confusion. NGOs have signed contracts without the U.S. government, without them knowing that there is a rule that stops them from using even their own funds to do abortion work. So not much is being said about it. They're not being informed. They're not being educated. They just blindly, sign. And it's after that has happened that they come to the realization that, oh, we're not supposed to do this.
Right.
Yeah. In general, the U.S. policy is out of step with Africa on the issue of abortion. For instance, we have the Maputo Protocol, which is the African Union Protocol on the rights of women in Africa. In Article 14 of that protocol, it makes provision for women who have become pregnant as a result of rape, incest, and other, health challenges to be given access to medical abortion in order to, sort out, such issues. And so the U.S. policy is completely at variance with the provision of that African Maputo Protocol. And so you ask yourself, the government, U.S. government is making this difficult through the Helms Amendment and the Global Gag Rule, and definitely at cross purposes with what the African Union, have agreed within their state parties. Also, abortion is treated as something isolated from other reproductive health care services. Abortion is very common. Abortion is a health care issue. U.S. policy stigmatizes abortion. And then, for me, I see that the U.S. government seems to make play politics with the women's lives, African women's lives.
Mm-hmm.
I mean, in America here, if any of the women gets pregnant and she wants to abort that pregnancy, she has access to quality care. So why stop other women? Does it mean that the lives of African women is not worth saving? That is the challenge that I see here.
Absolutely.
Yeah. And so...
And again, maternal mortality, right? Like it all comes together.
Yeah, absolutely. Because you cannot divorce, the contribution of unsafe abortion to maternal mortality. And if we are saying that women's lives matter and that women's lives need to be saved, then we must stop playing politics with the lives of African women. Our lives matter. Our lives matter. And what is good for the goose is good for the gander.
Exactly.
And that is my own position in this regard.
So you were here, you talked a little bit to Congress. Mm-hmm. So what would you say to U.S. lawmakers about U.S. foreign policy around global gag rule?
Well, Nigeria is facing a huge problem of unsafe abortion, which is something you don't face here in the U.S. Advocates and government in Nigeria are trying to address, the problem as we know how, by making abortion safe and legal. But the U.S. government is interfering. Women are dying from preventable causes, and we know how to solve the problem, but the U.S. is making it difficult. So I really want to call on the U.S. lawmakers to repeal this global gag rule. There is need to repeal that law, because if we say that women's lives matter, then we need to do something about this global gag rule. It is so very important, because women are actually society. They are the heartbeats of the society. And so we need to ensure that the women have, a way to go about their lives and have a right to make their reproductive health choices without any coercion, without any fear of or intimidation. I think this is very, very clear. Sometimes it beats me why we have to keep making laws about women's bodies.
I agree.
Why is that so?
Yeah.
The men are free to go about doing what they want. But when it comes to women, from ages past till date, even in this 21st century that we are in, we are still trying to determine how women use their bodies.
And women's health care
is completely not acceptable. Yeah.
Like women's health care is seen as like this separate thing and not just health care.
It's not seen as health care. And this is definitely not acceptable. And I therefore want to urge the lawmakers. You know, I really admire the U.S. Lawmakers, you know, because I have seen instances where they have risen to the occasion to do what is right. And I believe and I trust that they will do what is right by repealing this global gag rule, irrespective of their party leanings.
If you want to make sure that we end the global gag rule, as Hauwa is suggesting, make sure to write your lawmakers, write Congress, and tell them to support the Global HER Act. That is what this act would do. It would legislatively overturn the global gag rule, and it's really important that we pass it. And we'll make sure to include links in the show notes that you can access to tell your legislators to support the Global HER Act in both the House and the Senate. Hauwa, thank you.
And I think that we all have a role to play. Every citizen has a role to play. And it would be nice for every citizen to be counted on this very important work.
Yes.
Yeah.
Hauwa, thank you so much for being here. It was wonderful talking to you.
Yeah, thank you very much, Jenny. I'm glad you were able to accommodate me on this show today.
For more information, including show notes from this episode and previous episodes, please visit our website at reprosfightback.com. You can also find us on Facebook and Twitter at reprosfightback. If you like our show, please help others find it by sharing it with your friends and subscribing, rating, and reviewing us on iTunes. Thanks for listening.